Good morning, friends. I am Dr. Prashant Sahai, Head Department of Intensive Care and Anesthesia in Galaxy Hospital, Varanasi. Today, I take this opportunity to bring some awareness in the general public about sepsis. Today is World Sepsis Day, and the theme is to prevent and avoid the mortality and morbidity associated with sepsis and to cure it at the earliest. And sepsis, as a definition, you can say it's the hyper reaction of the body's immune system to the bacterial or fungal or viral infections which come into our body from someplace. And earlier it was thought that we were fighting the infection, but later on we discovered that it is not just the infection, it's actually the body's reaction and sometimes overreaction to the bacterial infections. And that in turn leads to tissue damage, multiple organ dysfunction, and at times death. It's a serious disorder. We must be aware and have to take care of ourselves. The causative organisms may be bacteria, which are very common, but even viruses, fungi, and parasitic infections can cause sepsis. And how do you recognize sepsis? It's actually very dicey. It's not very easy to diagnose because common infections and sepsis are a part of a spectrum and a very thin line differentiating it. But commonly we should look for if patient is having a high fever, rigor, cold, or even low temperature can be a sign of sepsis. Patient generally has a higher heart rate, high respiratory rate, and there are signs of other organ dysfunctions such as low urine output, maybe cold clammy skin. Patient can be disoriented, confused, and may even become unconscious. So we have to keep a close eye on a patient who gets sick. And these days, the viral infections are also causing very commonly, and people take it as easy as it's just a common cold. But it can proceed to sepsis. It could lead to sepsis and septicemic shock even. When shock ensues, BP of the patient is generally very low. Tissue gets less perfusion of the proper oxygenated blood, and people get disoriented. Several organs start decreasing their functions to different degrees, and the symptoms correlate according to that. Patient may become unconscious, disoriented, altered sensorium. And as far as treatment is required, it should be urgent and at war footing in intensive cares when patient is in septicemia or septicemic shock. It needs proper antibiotics, IV antibiotics, oxygenation, fluid management, and other supportive care such as supporting the organs which are failing. People will most probably need vasoactive medications to support the blood pressure, even ventilation to support the respiratory system, may need hemodialysis, CRRT, that is continual renal replacement therapy, to support different organs. But the most important thing is we should be aware, we should be knowing about it, and we should be suspicious. and contact your doctors as soon as you feel something is not going right with your fever or infection. Treatment might as well need surgery when the cause is something that is causing infection and can be removed. So we have to be very careful and keep an eye on sepsis, and we have to fight it. Thank you.